Yo, 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 what up, y'all? It's your boy Rob coming back at you once again with another live stream. So before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get it cracking. All right. So what we're going to be talking about today in today's live stream is monkeypox, COVID-19, and polio, as well as the new alleged killer strain of a new virus that's coming out of China. Now, you guys might have gotten an intro to this on Just Talking with TD and Rob. And if you're not subscribed to that channel, take a moment, make sure that you go over there and subscribe to that channel. Make sure you guys catch our live streams when we're live, because the live streams do not stay up. Posts of clips are put up sporadically throughout the week, and we go live every day, or I'm sorry, every Thursday at 2:30 p.m. Eastern time. So make sure that you guys check that out. All right. So we got a couple reports about monkeypox, which are very interesting. I have two videos that have a woman being interviewed about her experience with monkeypox and how she got it, which I find interesting because it's not the traditional way that's going on with the current spread of monkeypox. So let's take a look at this video that we got right here.
The fight against the monkeypox virus. The U.S. Health Department officially today declared a national public health emergency for monkeypox, George.
Sure did. The new state of emergency allows for a stronger federal response. Monkeypox has infected.
Facts. That channel is absolutely the best channel on YouTube. So if you guys ain't subscribed to it, you better use the search engine, because TD ain't going to put the link in.
More than 500 Georgians and over 6,600 Americans. Today's declaration means more money and resources are coming from the federal government. This is thousands of people in the U.S. deal with fevers, body aches, lesions, and fatigue.
And now we're hearing from the first woman to contract monkeypox in Georgia. Channel 2's Audrey Washington live at the CDC in DeKalb County. Audrey, the woman believes she somehow contracted the virus at work.
Right, she's a cashier, so she believes she contracted the virus by touching money and then touching her face. She told me she's coming forward with her story because she wants to educate more people about the monkeypox virus. Just a warning. So
now let's just put it out there. Now that is possible, right? Because if you guys recall, when we read the New England Journal of Medicine, the New England Journal of Medicine stated that it can be contracted by contact, and that's with contaminated items. So, bed sheets and, anything that might have monkeypox contagion on it. Okay. So that is possible. As much as we concentrate on the fact that this disease, the current spread of it is primarily through men who have sex with men, make no mistake, that is not the only vehicle of transmission. Okay. So this story could be true. Is it likely that it's true? I don't know what the likelihood of it is. This is this woman's personal account. Let's hear what she's got to say.
some of the images you are about to see are graphic.
I'm in the healing stages. As you can see, like, my face is starting to scab up.
It's been about a month and Camille Seaton is still recovering.
I like seeing like bumps pop up in this, I kid you not, in this same array, all over my face, and I just thought it was just a breakout.
That breakout, along with headaches, chills, and fatigue, didn't go away. So Camille went to the emergency room and got tested.
I waited on the results, and it was positive. I had monkeypox.
These are pictures of the lesions that started to form on Camille's face. Thursday, the Biden administration declared monkeypox a public health emergency. According to the CDC, there are more than 500 monkeypox cases in Georgia. Infectious disease doctors say those currently impacted the most by the virus are gay or bisexual men. But doctors also say that anyone can contract the virus through close contact. Camille is a cashier and believes she likely caught monkeypox at work.
I just want to let y'all know that I did not do anything sexual to contract this disease. This is spreading like it's here.
This week, I spoke with Dr. Jane Morgan and asked her just how transmissible the virus is and what, in addition to getting the vaccine, can people do to stay monkeypox free.
You can get it from sharing towels and from sharing bed linen. If the person who has used those towels or who slept in that bed is infected with the monkeypox virus, the normal cleaning and disinfecting processes should be maintained.
As for Camille, she wants anyone who hears her story to take this virus seriously.
These scars will fade, but you will forever notice.
And Camille is in isolation and out of work, so that's why she started a GoFundMe account to help with expenses. If you are interested in helping, just go to our website, WSBTV.com. You'll find all of that information there. And we are live here right outside of the CDC in DeKalb County. Audrey Washington, Channel 2 Action News.
So there's that. All right. So we have another video from that same individual who says that she contracted monkeypox through contact with contaminated money. All right. Which, again, you know, that's just
continuing to climb. There are more than 7,500 cases in the U.S. and a national health emergency.
Which again, you know, that's one of the rare ways that people are getting monkeypox is through contact with items. But you heard that doctor, and that's the same thing that I said, is that you can contract monkeypox in ways other than sexual contact. That's what it's been since the beginning. It's just that the most prevalent form of transmission is men who have sex with men.
Monkeypox cases continuing to climb. There are more than 7,500 cases in the U.S., and a national health emergency was just declared this week. Now, initially, the messaging was very clear about the outbreak being centered in the men who have sex with men community. This is still true, but children have come down with it, and women as well. We spoke with the first woman in.
So now my question is, how are children coming down with it? How are children in contact with the majority of people who have the disease? To me, that's just interesting. And also, if children are contracting the disease through touching contaminated objects, what are these people doing to contaminate those objects? I mean, it's just graphic and disgusting and not something that you want to think about.
In Georgia to be diagnosed with monkeypox, she believes she got it at work.
It was crazy. I was like, what is wrong with me? Like, wow.
Camille Seaton says it was like a scene from a movie when doctors wearing protective suits told her she had monkeypox.
Every doctor who would come into my room had a big old gas mask on and like bubble suits. And it made me feel really like alienated. Like, oh my gosh, like what's wrong with me for real?
The 20-year-old tells us she checked herself into an Atlanta hospital about 3 weeks ago after noticing some strange looking bumps on her face.
I even tried putting makeup over it. The makeup didn't do anything. Like the dots were so prominent, like on my face. And I was like, okay, that never happened to me before. I'm trying to hide a pimple. And then that night they turned like blisters almost. And I was like, okay, something's wrong. So I went to the ER.
Seaton is the first woman in Georgia reported to have the disease that until only months ago was rarely seen outside of Central and West Africa. The Marietta resident thinks she contracted monkeypox working at her job as a gas station cashier.
I say I got it from touching dirty money or touching surfaces, just not being mindful of what I'm touching, and then touching my face and then touching my hands and then touching my body. And now, you know, because let's be for real, like not everybody washes their hands every 15 minutes.
According to the CDC, anyone within close contact of someone with monkeypox can get it. And now more than 7,500 cases in the U.S. and a lack of available vaccines. Many are wondering how to slow the growing problem.
The doctors basically kicked me out of the hospital. Like they said.
All right, now here's my question for you guys in the comment section. How do you slow the spread of this? I mean, in my opinion, it shouldn't really be rocket science as to how you slow the spread of it, but knowing how it mainly transmisses, what are some ways that people can stop the spread of it? We all know washing your hands, you know, we all know making sure that you are mindful of what it is that you come in contact with. if you fall into that category of men who have sex with men, use protection and also make sure that you're with one sexual partner, not at man-on-man orgies like where this started to spread at in London. So what are ways that we can slow down or even stop the transmission of it? Should be pretty obvious, but for whatever reason, it seems like it's a mystery to the CDC.
Since there's no cure and it's new to them and there's no treatment, like, you feel very alone in this. You feel very alone in this.
And you really hear her talk about the isolation, the alienation. While Camille is healing from monkeypox, she cannot work. She is in isolation. There is a GoFundMe set up for people who would like to help. You can find it on our website, newsnationnow.com. And for more, we are joined by Dr. Anthony Harris. Dr. Harris, always great to see you. Thank you so much for being here.
Thank you, Natasha. Good to see you.
Good to see you. I do want to get your reaction after hearing that woman's story. You know, she thinks she got monkeypox from her job as a cashier. How concerned should people be who work in industries where they are in high contact with different items and different people all day?
Sure. Well, as you heard from...
I don't think that it would be a bad idea for people to wear nitrile gloves if you handle money all day, or if you deal with things that you have to contact, or if you're in close contact with people. And then, I mean, you know, you can get this from droplets. So it might not be a bad idea to stay with the C19 protocols and wear a mask. But for whatever reason, half of America thinks that that's just an imposition on their rights. They believe that they have the right to spread disease. So, you know.
Anthony Fauci, right? This is something that we need to be cautious of, be aware of, not to be in an alarm state, right? We know that monkeypox is and can be transmitted primarily through skin-to-skin contact with the body fluids from the pustules itself, but it prolongs skin-to-skin or touching, as mentioned, materials that were handled or soiled with body fluids from someone infected with monkeypox. So indeed, this may present, as the cases continue to rise, a possible work-related type of exposure, particularly if you're in an at-risk environment, particularly healthcare environments, as well as hospitality.
Well, we do know there's a monkeypox vaccine shortage. Is the current guidance still that it really is this men who have sex with men population who should get it? And in other words, eventually, do you think that this is a vaccine that all of us might be getting?
Sure. So if we look at the at-risk population, that is who delineates should be getting vaccinated, right? And so the at-risk population currently is, as you mentioned, men who have sex with men, but also individuals that may be at risk for exposure to individuals with monkeypox, right? And so again, I mentioned the healthcare environment in which you're in the front lines handling potentially infected patients. So it's not just limited to only men who have sex with men, but those who are high risk for exposure.
Well, you know, there's a lot of criticism as well about the public health response so far. Perhaps we didn't learn the lessons that we should have from COVID. Perhaps the U.S. should have assembled a task force and increased tests and vaccines as soon as cases in Europe started spiking back in May. Do you agree with that criticism?
So again, it's not even mentioned the thought of a European travel ban. In my opinion, as soon as they found out that the epicenter for this disease was in London, they needed to put a ban on all European travel and also require a negative monkeypox test in and out. But God forbid, you know what I'm saying? The people who run the planet can't have those kind of restrictions on them.
You know, I don't, because what we see now and what the secretary has done, what the administration has done, has declared an appropriate emergency. An emergency definition is an illness or communicable disease that threatens population health, right? The public health. And so it's not, again, at this point in time, an alarm state of panic, so to speak, like we saw early with COVID-19, but we need to be aware, we need to be cautious. And in particular, because of this declaration, we now can get access to funds that are appropriated to the secretary, to the CDC, the emergency response funds that were allocated back in 2019 can be accessed as well. That's going to speed vaccination development, manufacturing, and distribution.
Well, Dr. Harris, with the time we have left, I do want to pivot to another important health headline today. New York's health department saying that they fear hundreds of people may be infected with polio. What are you tracking with that story?
Sure. So this is a story that came about because of surveillance, which is done in wastewater, right? And we're looking at two communities in New York State that had active polio in the wastewater, and that isolate from that wastewater was identical to one case of paralytic polio, meaning that an individual was paralyzed by active polio infection. And so, what we need to be cautious of here is, in particular, those who are at risk for polio being unvaccinated individuals. You know, since the 19.
So there you go. TD is vindicated. TD is vindicated. And if you don't know what I mean by saying TD is vindicated, you guys got to look at those clips that he just put on the channel.
1955 in particular, we've been vaccinating for polio. It's a standard for children by age 24 months. 93% of children in the U.S. are vaccinated against polio. But if you're not, then you're at risk for polio. Polio is here in the U.S. It is in New York, and we need to be cautious of it.
All right, Dr. Harris, thank you so much for your time tonight. Appreciate it.
So there it is. We see exactly what's going on. We see exactly what the agenda is. So now we got a video here from CBS News Health Watch, and it's going to give us some general information about monkeypox. More than likely, it's stuff that we already know, but, you know, I hate to be honest, but most people, you know, have a little bit of memory issues. So going over stuff and reviewing, it never hurts. Yeah, I agree, bro. You are now vindicated. You know what I'm saying? Literally everything that you said in that segment of the live stream was on point, especially with what this doctor said. You know what I'm saying?
As cases of monkeypox increase around the U.S., so do myths and misinformation about the virus. The idea that it is a, quote, gay man's disease brings back painful memories of bias surrounding the AIDS epidemic in the 1980s. Joining us now to dispel those myths and break down the facts is Kavul Sheikh. She's a health and wellness reporter with the New York Times. Kavul, thanks for joining us.
Shout out to my man Ulaw. What up with it, bro?
Thanks for having me.
Break down for us how monkeypox is spread and who is most at risk.
Right. So right now, as you mentioned, the virus is largely limited to one group of people, which is men who have sex with men. But what we know of the virus.
Now, I don't understand why they're not saying white men who have sex with men, because that's the group. You know what I'm saying? That's who makes up 75% of the cases. You know what I'm saying? When it comes to a global human population, white men who have sex with men are disproportionately affected, but for whatever reason, the news doesn't speak in terms of that fact. Faulty journalism when it comes to covering these diseases.
From previous outbreaks where it mainly circulated in some African countries is
there we go, to African countries.
It can spread through three main ways. It can spread through physical contact, if you're directly touching somebody's rash or pimples, which are a clear sign of monkeypox, or if you touch contaminated clothing or bedding. And the other way is through respiratory droplets, like if somebody coughs or sneezes. And then there's also some evidence from past studies that the virus can be transmitted from a mother to fetus through the placenta. But right now, it seems like it's primarily spreading through the physical contact.
If it's primarily spreading in the gay community, I want to ask this question. As a gay man, I'm paying close attention. But as a journalist, I'm also asking, if it's primarily in that community, are we being a little too alarmist in sort of this public health declaration that really impacts everyone, right? What's the answer to that question?
That, in my opinion, that question that journalist just asked, that was an interesting and honest question. So shouts out to that guy for having a good and honest question.
That's a really great question, because I think a lot of the scientists and doctors that I've spoken to agree that it's important to highlight who is most at risk right now. And that's not really being alarmist. That's helping people who are most vulnerable be better able to protect themselves.
Right. You ain't allowed to do that. You're not allowed to ask direct questions that could, cause some people to look at the narrative sideways. You're not allowed to do that. You know what I'm saying? He could lose his damn job. If you guys agree with TD that this guy might lose his job, give me a thumbs up. If y'all disagree, give me a thumbs down. Look, ain't nobody in here, so this shit about to be blank.
And that's increasing access to and availability of the vaccines, treatments that are needed to contain the virus.
Well, does the data show that other groups of people are beginning to contract the virus more frequently? Or, as David's bringing up, should adult men who have sex with men still be the high-risk group?
Well, they're still the highest risk group, although there have been some cases reported in women and young children. Largely, the virus is limited to men who have sex with men. And like you mentioned, it's not a gay disease. The virus can't tell what your sexual orientation is. But because it's spreading through
For all the
sexual
people not here,
networks right
facts.
now,
My man Yulaw with the thumbs up.
Possibly cuddling, through sex, through the physical intimacy, that kind of prolonged skin-to-skin contact. That's why it's not yet in the broader community. So for most people, you don't really need to worry about it just yet.
I didn't realize this, but I'm looking at our producer notes. The first case of monkeypox dates back to 1970. What kind of treatments? I mean, we're talking a lot about the vaccine. Are there any treatments available other than the vaccine right now?
Yes, so there is a treatment called TPOXX or tecovirimat, which is FDA approved for smallpox, a related virus, monkeypox. It has been tested and proven to be efficient in animals, but it hasn't been tested in humans yet. But because the treatment works for smallpox, and we have evidence of that, and monkeypox is very closely related to that other virus. That's why we can use that treatment. It's an investigational new drug for monkeypox as well.
How would the Biden administration's public health emergency declaration benefit those in need of vaccines or treatment?
That's a good point, because the Biden administration just announced that it's a public health emergency yesterday. That can lead to more emergency funding.
So now I want to talk about these public health emergencies. And real quick, just to interject from here. As that lady said, monkeypox is closely related to smallpox. Now, here's my question for everybody that's watching. How many of you guys are familiar with Operation Dark Winter? I posted something on the Blacklight Revelations community page about Operation Dark Winter, but how many people really know what Operation Dark Winter is? If you know what Operation Dark Winter is, give me a thumbs up. If you're not familiar, give me a thumbs down. This is Operation Dark Winter, and you guys can look this up. Operation Dark Winter was the code name for a senior-level bioterrorist attack simulation conducted on June 22nd through 23rd of 2001. It was designed to carry out a mock version of a covert and widespread smallpox attack on the United States. So they just did a smallpox exercise on June 22nd through June 23rd of 2001. And yet and still, we're dealing with a disease similar to smallpox, and they're not prepared. So my question for everybody is, what's the point of these drills if we're going to remain unprepared? Shouts out to my man, DJ Elmo. What up with it, bro? So now here it says the objective, Operation Dark Winter, was focused on evaluating the inadequacies of a national emergency response during the use of a biological weapon against the United States or American populace, right? So now we don't know the certainty of whether this was a biological weapon or not. But what we do know is that there's been contagions that the United States has been dealing with. C19, now monkeypox. So despite the fact that it may or may not have been released with malice, the result and the turnaround and the remedies for it should be similar. The exercise was intended to establish preventative measures and response tactics by increasing governmental and public awareness of the magnitude and potential of such a threat posed by biological weapons. Now, what about naturally occurring biological agents that could be harmful to human life? You would assume that the remedies for these things would be the same. But for whatever reason, seems like the United States is still behind the ball. Dark Winter's simulated scenario involved an initial localized smallpox attack on Oklahoma City, Oklahoma, with additional smallpox attack cases in Georgia and in Pennsylvania, which is interesting because, you know, we have the big monkeypox epicenters in New York, which, you know, is pretty close to Pennsylvania. We have a lot of them in Florida, which is pretty close to Georgia. And on the West Coast of the United States, we have a lot in California. The simulation was then designed to spiral out of control. That's what we see going on right now. Monkeypox is spiraling out of control, as it has been. My man DJ Elmo says, just watched your Madonna video. Not surprised. It's a form of buck breaking. Bit like how Charlie Theron turned her adopted son to a girl. Psh, yeah, it's crazy. It's ridiculous. This would create a contingency in which the National Security Council struggles to determine both the origin of the attack as well as dealing with containing the spread of the virus. Now, the difference is that in our current scenario, we know the origin of the virus. At least this current spread, we know the origin of it. By not being able to keep pace with the disease's rate of spread, a new catastrophic contingency emerges in which massive civilian casualties would overwhelm the American emergency response capabilities. I mean, we saw that happen with C19, and we're seeing it happen now with monkeypox. So my question is, how much taxpayer dollars was spent on this exercise, and what was the end result? What was done? Did they make any changes? The disastrous contingencies that would result in massive loss of civilian life were used to exploit the weaknesses of the U.S. healthcare infrastructure and its inability to handle such a threat. The contingencies were also meant to address the widespread panic that would emerge and which would result in mass social breakdown and mob violence. Exploits would also include many difficulties that the media would face. Look at this. Providing American citizens with the necessary information regarding safety procedures. Discussing the outcome of Dark Winter, Brian Walsh noted the timing just a few months before the 9/11 attack was eerily prescient, as the organizers had foreseen how the threat of terrorism, including bioterrorism, would come to consume the U.S. government and public in the years to come. So now I want to ask everybody in the comments section, do you all think that the United States learned anything from Operation Dark Winter? And if they did, what is it? Are we seeing any learning curve? Is the United States handling these outbreaks that it's having efficiently? It seems like they didn't implement any of what they learned in this. So here's what the findings of this operation show. According to UPMC's Center for Health Security, Dark Winter outlined several key findings with respect to the United States healthcare system's ability to respond to a localized bioterrorism event. An attack on the United States with biological weapons could threaten vital national security interests. In addition to the possibility of massive civilian casualties, Dark Winter outlined the possible breakdown in essential institutions, resulting in a loss of confidence in government, followed by civil disorder and a violation of democratic processes by authorities attempting to restore order. Shortage of vaccines and other drugs affected the response available to contain the epidemic, as well as the ability of political leaders to offer reassurance to the American people. And it really doesn't help when we have an idiot in office like Joe Biden. That multiplies the effect of that times 5,000. This led to great public anxiety and flight by people desperate to get vaccinated, and it had significant effect on the decisions taken by the political leadership. In addition, Dark Winter revealed that a catastrophic biowarfare event in the United States would lead to considerably reduced U.S. strategic flexibility abroad, as we're seeing currently with the situations in Taiwan and the situations in Ukraine. Very interesting, right? Current organizational structures and capabilities are not well suited for the management of a biowarfare attack. Dark Winter revealed that major fault lines exist between different levels of government, federal, state, and local, between the government and private sector, among different institutions and agencies, and within the public and private sector. Leaders are unfamiliar with the character of bioterrorist attack, available policy options, and their consequences. Federal and state priorities may be unclear, differ, or conflict. Authorities may be uncertain, and constitutional issues may arise. Constitutional issues may arise. Now, let me ask you guys about that. Let's stay on that for a minute. Constitutional issues may arise? Constitutional issues like what? And shouts out to my man Muffet. What up with it, bro? What kind of constitutional issues? Constitutional issues like what we see people upset about right now? The constitutionality of vaccines? The constitutionality of lockdowns? The constitutionality of forcing people to wear a mask? What kind of constitutional issues? For example, state leaders wanted to control of decisions regarding the imposition of disease containment measures, mandatory versus voluntary isolation and vaccination. Richard, where my man Carlton Way at? Richard. This sounds eerily familiar, doesn't it? Still doesn't seem like the United States learned its lesson. The closure of state borders to all traffic and transportation, and when or whether to close airports. Federal officials, on the other hand, argued that such issues were best decided on a national basis to ensure consistency and to give the president maximum control of military and public safety assets. Leaders in states most affected by smallpox wanted immediate access to smallpox vaccines for all citizens of their states, but federal government had to balance these requests against military and other national priorities. State leaders were opposed to federalizing the National Guard, which they were relying on to support logistical and public needs, while a number of federal leaders argued that the National Guard should be federalized. So now here's my question that I want to ask everybody. Do you all feel that these issues have been taken care of? Do we now have a plan to be able to deal with this? Because, see, what we're dealing with right now with the way that monkeypox is spreading is that we don't know whether this was bioterrorism or not. We don't know. More than likely not. Which means that we don't have to deal with anything that could be possibly modified. So, what now? How do you go through an exercise like this and make no improvements, make no updates to the way that things are done? Because honestly, we did this way back in 2000. We've been through C19, and now we're going through monkeypox. And in my opinion, it does not seem that there is a significant learning experience. What it seems like is that they're still making the same mistakes. If you guys agree with that, give me a thumbs up. If you guys disagree, give me a thumbs down. There's no surge capability in the U.S. healthcare public health systems or in the pharmaceutical and vaccine industries. The exercise was designed to simulate a sudden, unexpected biowarfare event for which the United States healthcare system was unprepared. In the absence of sufficient preparation, Dark Winter, look at this, revealed that the lack of sufficient vaccine or drugs to prevent the spread of the disease severely limited the management options. So now here's my question. They did this exercise. This exercise was based on using smallpox as the disease that could be causing the problems, and they still have a small inventory of smallpox vaccine that they're attempting to spread over to many different places that have monkeypox outbreak issues. You'd have thought that after this, they would have at least increased their stockpile of smallpox vaccine, which would have helped them eventually be more prepared for monkeypox. But they didn't do that. So my question for everybody is, why do you guys feel that they didn't do that? Due to the institutionally limited surge capacity of the American healthcare system, hospitals quickly became overwhelmed and rendered effectively inoperable by the sudden and continued influx of new cases, exacerbated by patients with common illnesses who feared they might have smallpox and people who were otherwise healthy but concerned about their possible exposure. The challenges of making correct diagnosis and rationing scarce resources, combined with shortages of healthcare staff who were themselves worried about being infected or bringing infection home to their families, imposed a huge burden on the healthcare system. The simulation also noted that while demand was highest in the city and states that had been directly attacked, by the time victims became symptomatic, they were geographically dispersed, with some having traveled far from the original attack site. The simulation also found that without sufficient surge capacity, public health agencies' analysis of scope, source, and progress of the epidemic was greatly impeded, and that their ability to educate and reassure the public and their capability to limit casualties and the spread of the disease. For example, even after the smallpox attack was recognized, decision makers were confronted with many uncertainties and wanted information that was not immediately available. We're seeing that happen right now. Without accurate and timely information, participants found it difficult to quickly identify locations of the original attacks, to immediately predict the likely size of the epidemic on the basis of initial cases. And that's what we're hearing now. Anytime we talk about this, we're hearing them say, well, this is probably severely underreported. So now you'd have to ask, well, with all the technology that we have and all of the tracking apparatuses that we have, how is it severely underreported? And I got to agree with Muffet. They survive on fear and confusion. That's a fact. So now here it says dealing with the media will be an immediate challenge for all levels of government. Now, what does this mean? Dealing with the media. Now, this report came out long before social media was a major force when it comes to media. Social media has added even more consequences with this. So now here it says Dark Winter revealed that information management and communication will be a critical element in crisis consequence management. For example, participants worried that it would not be possible to forcibly impose vaccination or travel restrictions on large groups of the population without their general cooperation. See that? You can't do anything without general cooperation. So just understand that anytime anything goes down, anybody who says they don't want to do it, they're lying. Because if they didn't want to do it, then they wouldn't do it. And if they didn't do it, then it wouldn't work. The reason why people do these things and the reason why the government imposes these kinds of restrictions is because they know that people are sheep and scared and cowards, and they're going to do whatever they're told. To gain that cooperation, the president and other leaders in Dark Winter recognized the importance of persuading their constituents that there was fairness in the distribution of vaccines and other scarce resources, that the disease containment measures were for the general good of society, and that all possible measures were being taken to prevent the further spread of the disease, and that the government remained firmly in control despite the expanding epidemic. They need to come up with some new ways to make people believe bullshit, because I don't think that anybody's been buying it for any of the recent epidemics or pandemics. Should a contagious bioweapon pathogen be used, containing the spread of the disease will present significant ethical, political, cultural, operational, and legal challenges. In dark winter, some members advise the imposition of geographic quarantines around areas, but the implications of these measures, interruptions of the normal flow of medicines, food and energy supplies, and other critical needs, were not clearly understood at first. In the end, it's not clear whether such draconian measures would have led to more effective interruption of disease spread. What's more, allocation of scarce resources necessitated some degree of rationing, creating conflict and significant debate between participants representing competing interests. So now there's that. Constituents representing competing interests. That's interesting. That sounds like life in general, doesn't it? That's something that people should take a look at. Anytime people talk about topics like this, there's always somebody that says, well, how is that a black issue? I'll tell you how this is a black issue. We have a history, a nice little legacy of not procuring things that we need. So since we do have that kind of history, people might want to think about that going forward with all these new diseases coming out.
More development of vaccines and treatments. It could help government agencies hire more people that are needed for tracking and doing the testing and all of that. And it can also compel allow the CDC to get data from hospitals about who the patients are, who's been getting the vaccines. And that's really important for public health to be able to track in order to stop the virus.
Kavul Sheikh with the New York Times. Thank you for your time.
Thank you.
So there's that. All right. So
the World Health Organization declared monkeypox a global health emergency this weekend. While the number of
this right here is a video from PBS NewsHour, and this is a 10-minute video. This might actually be good to watch. Epidemiologists warn of critical moment to contain monkeypox. Now, I'm curious when this video came out, because, well, this came out on July 25th of 2022, and look at the tags: global health emergency, monkeypox vaccines, World Health Organization, people affected by monkeypox, LGBTQIA community, monkeypox, and the LGBTQ community. So that's how PBS tagged their video. You know what I'm saying? That's how PBS tagged their video. So I'm actually going to shelf this video real quick, and I'll look at it later and see if there's anything in it worth looking at. So in Cleveland, which is by me, there's been 25 new cases of monkeypox. So this thing is spreading super fast, just like we said it would. Still, in my opinion, not an adequate response from the government. Health officials have confirmed new cases of the monkeypox virus in Cleveland. As of Friday, the Cleveland Department of Public Health is reporting 25 cases in the city. The United States federal government declared a public emergency August 4th in response to the growing outbreak. All right, so let's see what this is here.
Numbers, well, there are some 6,600 reported cases of monkeypox in America. Last week, by comparison, when we did another press roundup, there were about less than 5,000 cases. As I mentioned last week as well, we had designated some 1.1 million vaccine doses that would go throughout the country. And now, today, we can report that we've delivered more than 600,000 of those Jynneos vaccine doses to our partners, state, local partners, tribal and territorial partners throughout the country. Administrator O'Connell will be able to give more detail on that. And on testing, we now have the capacity to administer some 80,000 tests per week. That has continued to rise, and we continue to try to encourage Americans to seek out a place to be tested. On treatments, for those who are infected, we have deployed at this stage some 14,000 treatments of TPOXX, a treatment that has been shown to help with those who have monkeypox. And we have, as I think we announced last week, roughly 1,700,000 of those treatments available in the Strategic National Stockpile. On education and outreach, we continue to talk with clinicians, public health partners, and affected communities daily. And I think there, Dr. Walensky and CDC can give us more detail. And this week, of course, the president made a very important announcement of his new White House coordinator for monkeypox response. He and the deputy coordinator will be coordinating this response, and we're very much looking forward to working with them under their leadership to make sure this whole of government response keeps us ahead of the virus and helps us contain the spread and outbreak. In light of all of these developments and the evolving circumstances on the ground, I want to make an announcement today that I will be declaring a public health emergency on monkeypox. We're prepared to take our response to the next level in addressing this virus, and we urge every American to take monkeypox seriously and to take responsibility to help us tackle this virus.
So we're supposed to take responsibility. Health departments in Summit, Lorain, and Portage counties have also reported monkeypox cases. According to data from the Centers for Disease Control and Prevention, Ohio has reported 78 monkeypox cases as of Friday. All right. So below are tips provided by Northeast Ohio health officials on how to decrease your risk. Avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. Avoid contact with objects and materials that a person with monkeypox has used. So that kind of gives credit to that woman in Atlanta and how she claims that she contracted monkeypox. Wash your hands often with soap and water or use an alcohol-based hand sanitizer, especially before eating or touching your face and after you go to the bathroom. Okay, so that's what they had as far as dealing with this monkeypox spread that's going down in Cleveland. All right. So now, if you guys recall, they talked about polio being found in the wastewater in New York City. Now, polio is especially dangerous because it has neurological implications. What that basically means is that it can cause paralysis, permanent damage. Okay, so this is something that can debilitate you very fast. If polio takes hold of you, it can be life-changing. Okay. So now here it says polio virus is found in New York City wastewater, showing spread of disease in New York. The polio virus was discovered in wastewater in samples of New York City, showing once eradicated and potentially paralyzing disease is circulating farther than places in Rockland and Orange counties where it had already been found. State and New York City health officials had announced on Friday. So now this is interesting. Looks like we got a little monkeypox testimonial here. Testimonial. Ugh. All right. So let's just take a look at this real quick before we go back to the polio info.
The pain was so excruciating, a prescribed opioid didn't help. That was the experience of a popular fitness trainer after he contracted monkeypox last month. CBS 2's Jackie Kostek has his message tonight.
Just watching your partner suffer was just the worst. I wouldn't wish any part of what we experienced on my worst enemy.
It's been about a month since Carson Twitchell and his partner contracted monkeypox, and he says just this week, he feels like he's fully recovered.
That's why we decided to go viral, because we wanted people to know how much of a joke this isn't.
I only had what I thought were bug bites.
Twitchell and his partner took to Instagram while in quarantine to share their experience with the goal of spreading awareness and countering what he calls the silly stigma around the virus. He says they both started developing symptoms about a week after they were exposed to the virus from someone who did not appear to have symptoms.
We didn't have any kind of a cough or a fever or chills or body aches or anything like that. Both of us had a couple of what looked like bug bites on our bodies.
Days later, Twitchell's partner was tested for a sexually transmitted infection and got a positive result for monkeypox. Twitchell was also diagnosed days later. He says the bumps were extremely itchy, but only became excruciatingly painful when they developed into lesions and sores.
We eventually were prescribed an opioid, hydrocodone, and the opioids didn't even touch the pain. There was just absolutely no relief from an opioid.
Twitchell says what eventually did help was an antiviral medication used for smallpox called tacovirimat, which he says they were prescribed because of the sensitive areas their lesions were in.
We did start to notice like our lesions in our sores behaving differently within 24 hours. So it was just then that we kind of realized like people need to know how hard we had to advocate for ourselves to just get them the
Facts,
attention
Muffet.
and medication that we desperately needed.
Jackie Kostek, CBS 2 News.
So there's that. All right. So now here it says the polio virus was discovered in wastewater samples in New York City, showing the once eradicated and potentially paralyzing disease is circulating further than places in Rockland and Orange counties where it had already been found, state and New York City health officials announced on Friday. The announcement gave no details about where in New York City the virus had surfaced and the date or dates of the sewage samples in which it was found. That's interesting. Health officials started testing past and current wastewater samples for polio traces after a Rockland County man suffered paralysis and was diagnosed with polio, the first U.S. case of the disease in years. So now my thing is, I think they need to be checking out where that might have came from. If you guys think that they should be checking out where that came from, give me a thumbs up in the comment section. If you guys don't, let me know what you guys think they should do about it. As of August 4th, the State Department of Health had said the polio virus had turned up in 11 sewage samples taken in Orange and Rockland County in June and July. In Friday's announcement, officials said they now had positive results from one or both of these counties from May, signifying that the disease had been circulating among unvaccinated people earlier than previously known. For every one case of paralytic polio identified, hundreds more may be undetected. State Health Commissioner Dr. Mary T. Bassett said, the detection of polio virus in wastewater samples in New York City is alarming, but not surprising. So they have a nice little polio flyer here. All right. And it says polio is spreading in Rockland County. All right. And it gives a little bit of a synopsis about polio and about the spread of polio. Nasty disease, not something that you want to deal with. All right. So now here it says Rockland County officials announced on July 21st that a young adult had been diagnosed with polio. The person was no longer contagious, officials said, but had suffered paralysis as a result of the illness. The polio patient had never been vaccinated against the virus, officials said. The polio case, the first apparently transmitted within the United States since 1979, came from a person who had taken an oral polio vaccine in a different country, a rare complication of the live vaccine, which has not been given in the U.S. in more than 2 decades, allowed the person to develop a mild case of the virus and shed it. Okay. Officials working to vaccinate New Yorkers against polio. So now, again, this is what TD was talking about. This is what TD was talking about as far as this push for specific ways of treating these kind of things. And you're seeing it right here. Officials working to vaccinate New Yorkers against polio. You know what I'm saying? Oh yeah, you have to monitor for side effects when it comes to giving vaccines. Now that's interesting. I wasn't aware of that, DJ Elmo. My man DJ Elmo says polio virus was also found in London sewage last week. Isn't that a coincidence? Now I'm curious as to if that polio was the same polio as this, because it said that this individual got that polio from a live vaccine that's not given in the United States. So he probably got that vaccine from somewhere else, and I wonder if it was in London. I'm not trying to be funny, but it seems like London is kind of diseasey. The U.S. Centers for Disease Control and Prevention has moved a smallpox team into offices at the Rockland County Health Complex in Pomona. It's a natural course of events, said Rockland County Executive Ed Day. A CDC field office was also set up during the 2018-2019 measles outbreak, when Rockland was an epicenter and saw more than 300 cases. Meanwhile, local outreach for vaccinations continue. Rockland County has partnered with Good Samaritan Hospital, Montefiore, Nyack, Rufia Health, and Serenity Health to produce 5,000 copies of an information flyer in 4 languages: English, Spanish, Haitian Creole, and Yiddish. More than 1,400 polio vaccinations have been given in Rockland since the case was reported, county officials said. Agencies with connections to the OJ and immigrant communities have been key, Day said. Rockland County is one of the most diverse in New York State, Day said. Our Department of Health has spent the last few weeks working closely with community partners to develop messaging that's effective and impactful to all of our residents, reaching all corners of Rockland with the simple message that polio is dangerous and only preventable by immunization is critical. So again, this is exactly what TD was talking about. Pay very close attention to what the focus of this is. Shout out to my man AJ. What up with it, bro? Pay very close attention to what the focus of this is. What are they focusing on? They're focusing on a particular method of prevention. And what method of prevention is it that they're focusing on? Let me know in the comment section. So now there you go again. Vaccination numbers lag as polio spreads. Vaccination rates have lagged for small children since the COVID pandemic, which some delayed well baby checkups and vaccination hesitancy grew. Rockland and Orange County have lagged behind much of the state, while school vaccination rates remain high. A 2019 law restricted vaccination exemptions for children in public and private schools. Rate for the children under 2 is lower than many other areas of the state. Rockland County, for example, has a polio vaccination rate of 60.34, and Orange County has a polio vaccination rate of 58.68. Among children who have received 3 polio immunizations before their second birthday, according to the state health department data from August 1st of 2022. In New York City, 86.2% of children between ages of 6 months and 5 years old have received recommendations of 3 doses of the polio vaccine. But there are New York City neighborhoods where polio vaccination coverage of children aged 6 months to 5 years dips even further. Williamsburg, Brooklyn, for example, has a polio vaccination rate for children in that age range that is just above 70%. Statewide vaccination rate for children 2 and under stands at about 79%. The risk to New Yorkers is real, but the defense is so simple. Get vaccinated against polio, said New York City Health Commissioner Dr. Ashwin Vasan. Polio is entirely preventable, and its reappearance should be a call to action for us all. So now, like I said, I mean, this article, for the most part, vindicates everything that TD was talking about in our live stream. So that's interesting. So I have another article here, but for the most part, this article says the same thing. It's basically just talking about where in New York City this was located, which we all know was Rockland County. So now I found another article here about that Langya virus, the new virus that has come from China. All right. And this virus is allegedly lethal at a high percentage. So let's check this out real quick. And real quick, ladies and gentlemen, if you guys haven't smashed the like button, make sure that you guys smash that like button. Also, if you guys are not subscribed to the channel, make sure that you go ahead and take a moment and hit that bell icon twice so that you guys get notification every time I go live or drop a video. So let's see what this is talking about here.
COVID is still here and doesn't seem to be going away completely anytime soon. But now Taiwan Centers for Disease Control and Prevention says they're now watching a new virus that is quickly spreading in China. They say it's a novel Langya virus, and so far at least 35 people have been infected in Shandong and Henan provinces in China. Labs in Taiwan are reportedly set to start genome sequencing on the new virus this week. That's according to Taiwan's CDC Deputy Director General. This testing will help them establish how the virus spreads, as well as looking for similar strains in Taiwan specifically. So far, symptoms include fever, fatigue, and coughing in humans. However, according to a New England Journal of Medicine letter to the editor, which outlined the virus's discovery, so far it has mostly been found in shrews. And experts cannot say just yet whether or not the disease is transmissible between humans. No deaths have been attributed to the novel virus so far, but the paramyxoviride family of viruses of which LAV belongs, according to the New England Journal of Medicine, can infect humans and cause fatal disease.
So there's that. China warns of new Langya virus that has sickened 35 people. Nearly 3 dozen people have been sickened by new virus spreading in China. So I don't understand, because in that video they just said they're not sure if it can go to humans or not, and clearly it can. I mean, if 3 dozen people have been sickened by it, right? With scientists warning it is too early to tell if it is deadly or spreads among humans. I mean, well, then how did 3 dozen people get it? Are they thinking that all 3 dozen people got it from shrews? The Langya or virus, or LAV, appears to be jumping from animals in parts of China, nearly 3 years after the coronavirus pandemic started there. It belongs to a family of viruses that are known to infect humans and cause fatal disease, a Chinese-led team of international scientists wrote in a peer-reviewed study in the New England Journal of Medicine. That includes the Nipah virus, which spreads from pigs and kills up to 75% of those infected, according to the World Health Organization. So far, none of the 35 infected LAV cases found in Shandong and Henan provinces have proven deadly. Of those cases, some 26 were found to only have LAV, not other illnesses, and all of them suffered from fevers, half of them having fatigue and cough. There were other abnormalities, with more than half, 54%, developing leukopenia, a decrease in disease-fighting white blood cells in the blood. More than a third also had impaired liver function, and 8% also saw worsening kidney functions. After testing 25 species of wild animals in surrounding areas, scientists found it in 27% of the tested shrews, suggesting that the small, furry, mole-like animals may be a natural reservoir of LAV, the scientists wrote. The same family of viruses has previously been known to spread among humans, but there have not been enough LAV cases to determine the status of human-to-human transmission, the scientists warned. There was no close contact or common exposure history among the patients, which suggests that infection in the human population may be sporadic, the study said optimistically. Contact tracing of 9 patients with 15 close contact family members revealed no close contact LAV transmission, but our sample size was too small to be certain, the report stressed. Taiwan's Center for Disease Control is among those paying close attention to the virus's spread, Channel News Asia stated. All right. So there's that. Now, as of right now, it looks like they're not certain whether this is being spread from human to human. But I think it might be kind of suspect if we look at this and in the near future, it becomes an outbreak spreading all over the place from human to human, because we have to ask the question, well, how did they miss that when they did these initial reports? So now here we're dealing with West Nile virus in mosquitoes. This is an article from July 22nd of 2022. So it's just interesting how all of these diseases are starting to resurface. Mosquito bites left a woman with West Nile virus infection that caused facial paralysis and diarrhea for 3 months. This woman had diarrhea and facial paralysis for 3 months as a result of a mosquito bite. Oh, yeah. I remember that V for Vendetta. Yep. All all those old school movies, comic books. So now here it says a woman in New Jersey experienced partial facial paralysis as a symptom of the West Nile virus, and she got it from mosquitoes. So now, in my opinion, that's one of the things that the United States government, they really need to be aware of. You definitely don't want these kind of diseases getting to where carriers can be animals that spread things quickly like mosquitoes. That would be absolutely bad news. She also reported weakness in one arm and diarrhea due to the mosquito-borne illness. Most people infected with West Nile do not experience symptoms, but cases involving the brain can be fatal. So West Nile disease can involve your brain, and that brain involvement can be fatal. Now, we're going to talk about some things with C19. Yeah, West Nile is back too, bro. We're going to talk about some things with C19, but C19 can affect your brain as well, and they're not really saying too much about that. So now here it says a woman in New Jersey could not move the right half of her face for months after she was bitten by mosquitoes infected with West Nile virus, according to a case report published online on July 14th. West Nile virus is the most common mosquito-borne disease in the U.S. It's actually transmitted during summer through fall, and it sickened more than 2,600 Americans in 2021, according to the Center for Disease Prevention and Control. The New Jersey woman sought medical attention for persistent diarrhea and low-grade fever in September. She told doctors that she received excessive mosquito bites on a hike before she began feeling ill, and she was discharged with antibiotics. The next morning, she woke up dizzy and had noticeable weakness in her right arm. Although she could feel her arm was not numb or tingling, her reflexes were not responding normally upon her admission to the hospital. Doctors did not identify the woman by name, but noted in the case report that the patient was white and in her 40s. There you go. Is that the reason why we haven't heard very much about this? Is that the reason why we haven't heard very much about this? They did not find signs of a stroke, and testing for various tick and mosquito-borne diseases came back negative before the patient was finally diagnosed with West Nile virus infection. Now, that's that thing. You have a house that you live in, but you went hiking. You know what I'm saying? Some people don't have the option to live in the woods, but some people decide to just go live in the woods. Like, it just doesn't make any sense. It just doesn't make a lot of sense. So now here it says most people who are infected with West Nile virus do not show symptoms of disease. So that's important. So if you encounter somebody who has West Nile virus, you may never know, because according to this, it says that people that have West Nile virus don't really show symptoms of disease. So that makes it extra dangerous, in my opinion. About 1 in 5 people with the virus get a fever with aches or gastrointestinal distress, and even smaller portion go on to develop neurological symptoms such as paralysis. So this woman here, she ended up getting facial paralysis 2 weeks later after the initial onset. No fun. Although the woman's fever resolved with rest and IV fluids, the weakness in her right upper arm continued. She was discharged to a rehabilitation facility 9 days after 9 days in the hospital. A week into rehab, the patient said she could not move the right half of her face. Doctors wrote in the case report. She was diagnosed with Bell's palsy, a condition characterized by temporary paralysis or weakness of one side of the face. Several different viral infections, including shingles and herpes, which are related to monkeypox, by the way, have been associated with temporary facial drooping, but only one case of Bell palsy related to West Nile virus was described in medical literature before this patient. About 1 in 150 West Nile virus infections escalate to cause severe neurological symptoms, including muscle weakness and paralysis, according to the CDC. If the virus reaches the brain or spinal cord, it can cause headaches, light fevers, neck stiffness, disorientation, tremors, loss of vision, or even coma. These symptoms may resolve over several weeks or months, but some effects are permanent. The patient in New Jersey saw her facial paralysis resolve 3 months after it started, but she continued to experience some gastrointestinal troubles. The muscle weakness in her right arm only improved moderately in comparison to the facial palsy. While West Nile virus infection is fatal in about 1 in 10 cases involving the central nervous system, according to the CDC, people with certain medical conditions, including cancer and diabetes, as well as people over 60 years old, have a greater risk of developing severe illness with West Nile virus. So be careful about hanging out near puddles, because you guys know that's where the mosquitoes are. They could be carrying West Nile virus. Yeah, exactly. We'll save that for the podcast, bro. Just wait for it. West Nile is disproportionately affecting Black Americans. just wait. You know what I'm saying? Just wait for it. It's coming. So let's see. Let me see this real quick. So I don't think we should read this. Let me see. That's old. We all know about all this. We know who's eligible for the monkeypox vaccine. And another thing we know is that it's spreading like wild in California. So what we're going to talk about now is some of the neurological effects of COVID-19, because that's not something that they talk about too much. One of the symptoms of COVID-19 that used to be an early identifier was if you lost your sense of smell or if you lost your taste. But apparently there's been some issues where people are not getting those sensations back. That's kind of scary. Still struggling with your sense of smell after a bout of COVID-19? You're far from alone. So now, here it says about 5% of patients confirmed with cases of COVID-19, some 27 million people worldwide, are estimated to have suffered long-lasting loss of smell or taste, a new analysis suggests. In the analysis published Wednesday in the BMJ, the peer-reviewed medical journal of the British Medical Association, researchers evaluated 18 previous studies of smell and taste loss across several continents in varying demographic groups. About 3/4 of those affected by loss of taste or smell regained those senses in about 30 days. Rates of recovery improved over time, but about 5% of people reported persistent dysfunction 6 months after their infection with COVID. The analysis suggests loss of smell and taste could be a prolonged concern that requires more research and health resources for patients struggling with long-term symptoms. Now, in my opinion, they're skipping steps here. Before they go on to look at that kind of stuff, I think they need to take a look and see if COVID has any direct effect on the neurological system. That's what I would do. That's what I would do. So now here it says losing smell has been linked to higher death rates in older adults and has been shown to have major impacts on people's emotional and psychological well-being, said Dr. Zara Patel, a rhinologist at Stanford University who was not involved in the BMJ research. Having these now millions more people worldwide with decreased ability to smell, that may simply be a new public health crisis, Patel said. All right, so I'm going to move this back a little bit. Loss of smell was one of the most distinct markers of COVID-19 in the pandemic's beginning days. You guys remember that? People were complaining that they weren't able to smell in the beginning of the COVID-19 pandemic. If you guys remember that, give me a thumbs up. If you guys don't remember that, give me a thumbs down. You could track the pandemic across the globe by analyzing Google searches about smell loss, Patel said. The BMJ analysis gives a broad review of smell studies across the world and over time. Data from nearly 3,700 patients was included in the analysis. So let's check out this little video that they have here.
This morning in our continuing series, Today's Checklist, a medical mystery that has perplexed researchers and doctors for the past 2 years, long COVID.
Oh, man, it sure has. That's COVID symptoms that persist for months, sometimes even years after the first infection. It's actually now the subject of numerous studies and a congressional inquiry. So we brought our expert, Dr. Natalie Azar, to walk us through what we know and what we don't. Good morning, Dr. Nat.
Good morning. Hi. Good morning. Good to see you.
So congressional inquiry, very, very serious.
Yeah.
What is it about long COVID that has got all this attention on it from our elected leaders?
So here's the thing. But even before we talk about the exact definition, I just want to make a point that I think is really important. We've talked a lot about coronavirus being a novel virus, which it was. Long COVID is not a novel situation, though, because it does have a lot of resemblance to something called chronic fatigue syndrome, which we will talk about. So I think it's just important for people to understand that this is the first time we've had so many millions of people experiencing this kind of situation.
Okay.
So according to the CDC, and by the way, there's no globally accepted definition of long COVID, but it's symptoms that last typically for 1 month or longer after the onset of your illness. No alternative diagnosis. So of course you have to rule other things out. The symptoms can go away and then come back. A lot of people don't even have some of the symptoms early on and then 5 months later develop things. The cause is unknown, and we have here immune response, which is a little bit of a catch-all, Jacob, because experts are trying to figure out so much.
I want to ask you guys a question. Do you guys remember how when COVID first started, there was a big group of people saying that it was fake? You guys remember that? If you guys remember that, give me a thumbs up in the comment. Now, my question is, what happened to that group of people? And is COVID fake? It's clearly not. It's clearly a concern. It's clearly real. It clearly affects people. So now my question is that when you see evidence that there is an issue, an ongoing issue, how do you remedy it by just simply saying that it's fake? Just because you don't like how it's being managed. I don't like how it's being managed, but I'll tell you what, it's real. Yeah, I agree with Muffet. They are still there. It's just fascinating the way that some people feel that it's appropriate to remedy certain things. There's nothing fake about this. I know some people that are experiencing long COVID as we speak.
What's going on? Is there a persistent virus there? Is there a persistent triggering of the immune system? Is there organ damage? There's a whole immune milieu that's happening that researchers are studying, but we don't have one unifying explanation for why people experience the symptoms.
Yeah, bottom line, we're not sure exactly what it is quite yet.
No, but to my first point, this is the first time that the entire research community global.
Yeah, I do remember that. There was a whole group of people. Shout out to Last Name. What up with it, Last Name? There was a whole group of people that were saying that. And I was just like, okay. I never heard anything like that, but all right. And I've seen, some of us with it, but okay. And then they just disappeared. They just disappeared. Maybe they maybe they ended up getting it and it made them disappear.
The world community and funding has been focused on this, something that CFS patients have been longing for decades. And now we finally hear, but it's not going to be overnight that we're going to get all the answers.
All right.
So you mentioned symptoms.
Yes.
So I had COVID 2 weeks ago, still feeling it, tired. We were talking in the studio.
Yes.
6 months, somebody can't taste or smell.
Right.
What's the difference between having after effects and how long does it quantify long COVID?
Right. So I think one of the biggest messages that I want to get across to people is that not all long COVID is the same. Sometimes people can have what I would refer to as a long tail, meaning you lost your sense of smell and 6 months later, a year later, you still don't have it, but everything else is okay. That's long COVID, but it's not the kind of syndromic fatigue that I'm referring to with chronic fatigue syndrome. So what are the more common symptoms? Well, it's extreme fatigue, but this doesn't even do it justice. This is like can't get out of bed.
Right.
Used to be able to run.
You see down there, the third bullet point, neurological symptoms, COVID brain. That's real. That's real. Yeah, I agree, Muffet. Nothing should be ruled out. People need to look at every single factor that's involved with this. Every single factor.
And can't do that anymore. Some patients just present with persistent shortness of breath. They can present with heart rate and blood pressure dysregulation, COVID brain, the fog, the cognitive fogginess, headaches, and then all these unusual things, pain, rash, menstrual changes, GI, we didn't even have it on there, GI symptoms. So you can see how heterogeneous it is, right? Some patients present, again.
Yeah, there's a lot of evidence, DJ Elmo, that's coming out that's showing that vitamin D has a lot to do with being able to recover as well. I don't know. The studies have been inconclusive, but it says that they might improve your immune system or improve your immune function.
With just the neurological stuff, and some patients present just with pain. So it's a mixed bag, which makes it harder to study.
Right, so
and
much
treat, of
unknown.
course.
So I have a question because I know people who are in their 20s who are suffering from long COVID, and I know people who are in their 40s and 50s who are having problems. So are there any risk factors for people who may get hit so hard?
Right. So I think the biggest challenge and the thing that has scared anyone who's otherwise healthy is going, am I going to get COVID and not just have the sniffles, but end up unable to get out of bed? The answer is we don't know who that person is. It's hard to recognize who that's going to happen to. But what we do know is that people who initially have severe symptoms, maybe they're hospitalized, they're in the ICU, they're intubated, they have underlying health conditions, which means they're going to have more severe illness, tend to have more like long kinds of symptoms and take longer to recover, maybe more long-term impairment. And obviously vaccination, because.
So now my thing is that why aren't they trying to match up long COVID cases with the strain of COVID that someone was infected with? Because it could be the particular strain that a person gets that could be contributing to them getting long COVID or not. But I don't think that they're doing that particular kind of study, which makes me wonder why not? Why aren't they doing that particular kind of study?
Vaccination reduces viral load. So if you have less viral load, you have less of that, insult from the virus.
Okay, so finally, then is there a definitive diagnosis or what are the treatments for long COVID?
No validated test. So there's no checkbox on your, Quest Diagnostics form, unfortunately, but it is a clinical diagnosis.
Okay.
The etiology, as I mentioned, unknown, but an area of active research right now. There are no specific treatments, meaning I have long COVID, you're going to get this, cocktail.
I believe it.
But we treat the specific.
I have coworkers and I've dealt with people that are dealing with this long COVID as well. And it's crazy because you can see it. And my thing is that when it comes to talking about COVID, that's one thing that they don't highlight. They rarely talk about the neurological implications because there's a lot of them. There's a lot of neurological implications that they kind of just let slide. You know what I'm saying? Real quick, ladies and gentlemen, if you guys haven't smashed that like button, we got 12 live viewers. Shouts out to everybody that's watching. And we got 13 likes. If everybody hits that like button, we'll have 25 likes, which would be great. So please take a moment. If you haven't smashed the like button, smash the like button. And also, if you are enjoying the contest, enjoying the contest, man. What am I talking about? If you're enjoying the video, make sure that you guys smash this like button. Yeah, it's a contest to make sure that you don't catch COVID. And if you don't, you win.
Specific symptoms. So patients who have persistent shortness of breath, they do pulmonary rehab. Patients who have the heart rate, blood pressure thing, that's called dysautonomia. There's treatment for that. There's treatment for pain. So it's right now, it's very much a holistic approach. There's tons of trials in the country right now. As Jacob was mentioning, a lot of funding efforts are going into this, but it's frustrating for the patients who are suffering because it doesn't mean an immediate, intervention that's going to help them today, but we're getting there.
I feel like as a society, we kind of, not that we're lax, but we're like, oh, I'm vaccinated, we'll wear a mask, we'll be okay. But then when you hear stories like this, you realize we're not out of this.
I remember very early in the pandemic when I was like.
Remember how I kept telling people, just because you're not hearing about C19 in the mainstream media anymore doesn't mean that it's not going on. And I would hear people people would they just constantly repeat, well, you're not hearing about COVID anymore. And it's like, okay, you're not hearing about COVID anymore because you're not really looking for the information. If you look hard enough, you'll be hearing about COVID because there's things going on with COVID all over the place. It's not difficult to find. You know what I'm saying?
Like, I'm not afraid of, God forbid, dying. I'm afraid of long COVID because we started seeing it early. And I know a lot about this condition. So it was like, that's the thing I want to try to avoid if I can.
Yeah, thank you for making it understandable because there's so much unknown.
As always, thanks, Dr. Nat. Always scary
right.
to not know the answers. Thank you for being here. And for more information on long COVID, head to today.com.
All right. So now here it says studies from North America, Europe, and Asia were all included in the analysis, which noted that women were less likely to regain their sense of smell and taste than men, which I find interesting because women, they already have sense of taste and smell that is kind of variable. I don't know how many people have a wife or a girlfriend or, baby mom or whatever that they were with during a pregnancy, but as most people will know, and women will verify this, women's sense of smell and taste tends to change with pregnancy. So, women are sensitive in that way. And I find that interesting that it has a effect on women more so. See, it says women were less likely to regain their sense of smell and taste than men. Patients with greater nasal congestion were also less likely to cover also. So it seems like if you already have some kind of sensitivity or some kind of issue with your nose, you may be less likely. That's what it seems like, at least from the information that they have here. Now, here it says the analysis showed steady increases in the proportion of patients who recovered their sense of smell over time. After 30 days, about 74% of patients had recovered it. After about 90 days, that number was up to 90%. After 6 months, about 96% of patients said that they were able to smell again. So another thing that you can notice from this mathematical pattern here is that as you go beyond 6 months, if you're in that 4% of people that hasn't recovered yet, recoverhood likelihood may seem to decrease. How are you afraid of dying, but you're not afraid of long COVID? Right. My man DJ Elbow says none of these fools in the media have mentioned a healthy diet, vegetables, fruits, reduced junk and food and sugar consumption. Didn't their Hippocratic oath say, let food be thy medicine? They don't read that Hippocratic oath. It's actually a hypocritical oath, if you ask me. So now here it says scientists are beginning to grasp how COVID-19 affects the smelling function. The coronavirus often causes swelling in the olfactory cleft. That is the passage in the part of the upper nasal cavity where humans perceive the sense of smell and process flavor beyond basic tastes, like sour or bitter. Researchers think that the virus does not initially affect the olfactory neurons, but instead latches on to support cells, which help the neurons provide a signaling pathway. So now my thing is, any neuro environment is dangerous, or any neuro involvement is dangerous. You don't want something messing with your nervous system. Nervous system tissue doesn't regenerate. So in most cases, if you have a damage to your nervous system, there's no coming back from that. You're dealing with permanent damage. And your nervous system is important to your cognition. It's important to your function. It's important to your musculoskeletal functionality. It's extremely important. It's not something that is negotiable. You know what I'm saying? So now here it says patients who suffered smell loss after COVID-19 make up a unique subset, said Dr. Ari Jafari, a rhinologist at the at the UW Medicine Sinus Center in Seattle, who was not involved in the new analysis. They tend to get better kind of quickly and make sense based on the cells that are affected. Jafari said that about half of his patients deprived from the sense of smell likely had COVID-19 at some point. Many experience dramatic impacts on their well-being because of the loss. They tend to be distraught about the loss of sense of smell. It's such an important part of our everyday and what makes us human, Jafari said, adding that he's treated a professional chef, a chocolatier. Well, I don't know what the hell. What the hell is a chocolatier? What is a chocolatier? And other whose livelihood depend on their ability to determine smell and flavor. The most common thing I hear is that it leads to social isolation and feeling disconnected from the world and society as they know it, and it can really be bothersome. So let's check this out.
You may have seen different versions of this very colorful chart from the Centers for Disease Control, given that we've been flooded with more and more new contagious coronavirus variants in the past year. This is the CDC's variant proportion chart. It tells you how much of the coronavirus floating around our country is from one variant versus the other. And it shows you how those proportions have changed over time, which is why you get that left to right color gradient. This chart, specifically the greenish teal bar on the chart, has sparked a bunch of headlines this week about the new subvariant of Omicron with the very clinical name BA.5. Some headlines are calling it, quote, the worst virus variant. BA.5 is now the dominant strain in the country. It accounts for more than half of the country's COVID cases. We know it's more contagious than any previous strain we've come across so far. And experts say there are some early signs that this variant might make you slightly sicker than previous strains. We're waiting to get more data about that, but here's why it matters. Let's have a look at that chart again. What does it tell you? It tells you, yes, BA.5 is the dominant strain. You can see that on the right side. It also tells you that this virus keeps on changing. It keeps mutating. Every couple of months, it looks like there's a different dominant variant or subvariant. Every couple of months, the most prominent color on this graph changes. The vaccines and treatments we currently rely on to rein in this virus are based on old strains of coronavirus. And so far, that's worked out okay, perhaps until now. Many experts say this new strain of the virus, BA.5, is changing the playing field under our feet as we try to finally defeat this virus.
Shout out to my man Ulaw for helping your boy out with what a chocolatier is. A chocolatier is a maker or seller of chocolate. That's hilarious. DJ Elmo says nervous system like myelin sheath, choline has been shown to help. Omega-3, DHA, and EPA fatty acids are also helpful. Yeah, and people should be taking those as it is. And I'm assuming as far as nervous system goes, B vitamins as well will probably help.
Reason is something called immune escape. BA.5 is getting around the immunity built by recent COVID infections and vaccines better than previous strains did. Already, daily case numbers are trending upward. Take a look. That's on the right side of the screen. It doesn't look like much, but it's a bit of a trend because of BA.5. Anecdotally, it just feels like more and more people around us are testing positive. Hospitalizations in this country have also been trending up steadily since our most recent COVID spike in May and June. We know from our winter battle with the original Omicron variant that if this virus can create enough new cases quickly, there can be crippling spikes in hospitalizations, even if it's not a whole lot more virulent than previous strains. So I have questions about what all this means for us and what we can and should do to protect ourselves against this current version of the virus. And I know who just to ask. Joining us now is Dr. Vin Gupta. He's an MSNBC medical contributor, critical. You'd think I know this, right? Vin, after introducing you, how many times have I introduced you? Critical care pulmonologist and a faculty member at the Institute for Health Metrics and Evaluation at the University of Washington. We have been speaking for over 2 years now. Dr. Gupta, thank you for being here. On one level, we do not have the level of tension that we had in March and April and May of 2020. On the other hand, we have this new strain, and we're a little confused as to what we're supposed to do about it.
Ali, always great to see you. Good evening. It's true. And the fact that really worries me is that 3 in 4 adult Americans that are eligible for their next booster shot, number 3, that next booster shot, have decided that they're not going to get it. Or in some cases, if you're eligible for that 4th shot, they're not going to get it. That is concerning in this era of a more transmissible variant, because Ali, come the winter time, if we're not up to date with our vaccines, those individuals who are higher risk are going to be the most likely to end up in the hospital, because while we focus so much on antibodies, blocking the virus from causing us to test positive, blocking the onset of a sore throat, the really key component here is something called T cells that harbor pretty much in our lungs. They help prevent severe infection from occurring, but it turns out those T cells do.
Oh yeah, and you know what's crazy about it, Muffet, is that if you counter what the media is saying, if you counter it where it can be detected by YouTube or by YouTube's algorithm, they'll strike your video as medical misinformation. And they really will. So it's interesting to pay attention to what you are able to counter versus what you aren't. It's really kind of crazy. The censorship when it comes to talking about this kind of stuff is really very sensitive.
Do require periodic boosts, and the people that need those boosts the most are not getting them. That's why we're really concerned about the winter and potentially surging again in the hospitals.
Exactly. What they're not saying is that there's already plans to try to work on a BA4, BA5 specific variant, because BA4 and BA5 are so much more efficient at evading, quote, immunity than the other variants. The BA4 and BA5 variant are very different than all the previous variants before them, before all the predecessors. So what I find fascinating is it's like, yeah, you know, this may or may not work for this, but go ahead and do it anyway. It's like, we don't make that kind of decision with anything else, but we should make that kind of decision with this. Doesn't make any sense.
Thank you for being here. On one level, we do not have the level of tension that we had in March and April and May of 2020. On the other hand, we have this new strain, and we're a little confused as to what we're supposed to do about it.
Ali, always great to see you. Good evening. It's true. And the fact that really worries me is that 3 in 4 adult Americans that are eligible for their next booster shot, number 3, that next booster shot, have decided that they're not going to get it. Or in some cases, if you're eligible for that 4th shot, they're not going to get it. That is concerning in this era of a more transmissible variant, because Ali, come the winter time, if we're not up to date with our vaccines, those individuals who are higher risk are going to be the most likely to end up in the hospital, because while we focus so much on antibodies, blocking the virus from causing us to test positive, blocking the onset of a sore throat, the really key component here is something called T cells that harbor pretty much in our lungs. They help prevent severe infection from occurring, but it turns out those T cells do require periodic boosts, and the people that need those boosts the most are not getting them. That's why we're really concerned about the winter and potentially surging again in the hospitals.
So I know they've been throwing away dosages of vaccines because they have a certain shelf life, and it's not just in the United States, Canada, Germany. A lot of places are getting rid of vaccines.
So now I find this interesting. The United States and Germany and Canada and all these different countries, they're getting rid of vaccines, while countries like India, you know, and many African countries have a shortage of vaccines, but the United States is throwing them away. The reason why I said India first is because India has made the loudest noise, and India has directly addressed the United States. The other countries, the African nations, have failed to do that. So that, if you know, people get sensitive about those kind of things. Oh my God, you said India first. You know what I'm saying? Like, yeah, I did say India first because they had the nuts to actually stand up to the United States on that. So, you know what I'm saying? So there's that.
Do you feel what's supposed to happen? Is it just a matter of everybody being up to date on their vaccine regimen, or are we discussing more vaccines? And what about this immune escape business? The idea that this new variant, the BA5, seems to be able to bob and weave its way around your inherent ability to fight this off because you've had COVID or because you've been vaccinated properly.
Well, Ali, that last point, let's take that last point first. That is not unexpected. In the setting of a contagious respiratory virus, like say flu, for the last 40 years, all of us have been getting immunized against flu, but much longer than that. Flu evades, it causes immune escape all the time. We test positive for flu even if we've gotten the shot, but it's about 50% effective at keeping you out of the hospital. That's where we're headed. A vaccine, we're already there, a vaccine that is going to keep you away from somebody like me, but not prevent a positive test. This is entirely expected. We're going to have.
He said that's where we're going, comma, we're already there. You guys hear that?
Vaccines. And what about this immune escape business? The idea that this new variant, the BA.5, seems to be able to bob and weave its way around your inherent ability to fight this off because you've had COVID or because you've been vaccinated properly.
Well, Ali, that last point, let's take that last point first. That is not unexpected. In the setting of a contagious respiratory virus, like say flu, for the last 40 years, all of us have been getting immunized against flu, but much longer than that. Flu evades, it causes immune escape all the time. We test positive for flu even if we've gotten the shot, but it's about 50% effective at keeping you out of the hospital. That's where we're headed. A vaccine, we're already there, a vaccine that is going to keep you away.
See that? He had a cocaine is a hell of a drug moment.
For the last 40 years, all of us have been getting immunized against flu, but much longer than that. Flu evades, it causes immune escape all the time. We test positive for flu even if we've gotten the shot, but it's about 50% effective at keeping you out of the hospital. That's where we're headed. A vaccine, we're already there, a vaccine that is going to keep you away from somebody like me, but not prevent a positive test. This is entirely expected. We're going to have a more contagious variant likely occur down the road. We shouldn't be surprised by it. To your point, is there going to be an up-to-date vaccine come fall? For everybody wondering, should they wait for that 5th booster shot? If they haven't gotten their 3rd shot, should they wait till fall for an up-to-date shot? I would recommend that you get that up-to-date shot if you haven't already. But once it becomes available in September, that's going to give you strong protection against infection for a period of time, but certainly keep you out of the hospital. More broadly, Ali, we need to be thinking about a therapeutic strategy. I know the Biden administration is thinking about it. They're trying to institute test to treat, but we need to be clear-eyed about what a therapeutic strategy looks like come the winter and make it even easier than it is now.
In terms of prevention, a lot of people talk about the fact that, it's becoming just like the flu, but the distinction is you always know when you have the flu. You are contagious once you have it. This continues to be something where people are contagious in many cases without having any idea that they're carrying the virus.
That's right. That's right. And so asymptomatic infection this is a big reason why this has become a global pandemic. People are carriers. They don't know it. They're fully vaccinated, but they are still potentially contagious because they have vaccine breakthrough infection, but they don't have symptoms. Turns out in the setting of BA.5, for all your viewers out there, just because I've gotten this question a lot, you can be contagious for a longer period of time. Conventional wisdom in the era of, say, the Delta variant was 5 days and then you're good. If you test positive on day 0, day 5, you're feeling okay. You can take off that mask potentially. In this case, you're contagious up to potentially as long as 8 days. So contagiousness is for a longer window of time. Important for people to recognize that if you tested positive, you're fully vaccinated, when can you take off that mask if you're otherwise feeling better? When that rapid test goes from positive to negative. If there's enough to infect, there's enough to detect. I didn't make that up. Somebody else did. But it's a good truism to live by.
Vin, thanks as always for being so helpful to us in understanding these complicated matters. Vin Gupta is an MSNBC medical contributor, a critical care pulmonologist, and a faculty member at the Institute for Health Metrics and Evaluation at the University of Washington.
So there's that. All right. Jafari said that many patients also describe a transition period that can be distressing as their sense returns in which they smell things that aren't present. So they have something similar to hallucinations, like burning rubber or smoke, or experiencing abnormally foul smells. People who are unable to smell or sense flavors can have higher rates of psychiatric illness, depression, and anxiety, Jafari said. In an extreme case, Jafari said he treated a patient who became malnourished after losing the senses of smell or taste. And that makes sense because you're not going to want to eat. You know what I'm saying? People want to enjoy their food. And also, people use their smell to trust their food. You know what I'm saying? You smell it to make sure that it's okay. Smell underlies the way that we interact with each other and make our world, or make our way in the world, dictating your first impressions of other people, the people we choose for sexual encounters or for lifelong partners. Oh, God, Patel says, Cues from the scent could subconsciously influence people's attraction to others based on their underlying genetics, and hygienics. Hygiene matters. You know what I'm saying? Ugh. The analysis relies on studies using data that was self-reported by patients. Patel said that could underestimate the true toll of smell dysfunction and skew some of the research findings because people are sometimes unable to perceive how much sensitivity that they have lost. The study's authors agreed. Many previous studies have shown that objective smell testing can identify far more people with smell loss than if we asked them to self-report, wrote Professor Song Tartaw, an author of the study and head of the Department of Otology, Head and Neck Surgery at Singapore General Hospital in an email. The true number of people affected is likely to be far higher than our estimate. Patel suspects the true rate of smell dysfunction among those who have experienced COVID-19 could be above 20%. It could be that women are not more likely to struggle with recovery, but are more perceptive of a prolonged deficit in their ability to smell. Women overall have, on average, more acute sense of smell than men, Patel said. We know people with a more acute sense of smell or taste are much more likely to recognize when they have a loss and more likely to seek care for a loss. That makes sense. Jafari said that the BMJ analysis generally tracks with his clinical experience and his observation of patient recoveries. It's nice to collate data from all around the world to better understand what's going on and to take some variability out of these analysis specific to a patient population or institution, Jafari said. It increases the level of evidence overall to support what we as sinus surgeons see in our offices. Initial variations of the Omicron variant seem to affect the sense of smell less than previous waves of COVID-19, Patel said. But the latest subvariant, BA5, could be reversing that trend. So see, this is what I'm telling you guys about BA5. BA5 is a completely new and uncharted monster. We don't have enough data yet to know for sure, Patel said. I'm now in my clinic starting to see an uptick again. Treatments are available for people who have lost their sense of taste and smell due to COVID-19. Structured olfactory training in which patients twice a day sniff essentials, oils like lemon, clove, eucalyptus, and rose to stimulate different types of neurons can reteach the brain to recognize different scents. Doctors will often prescribe a steroid rinse for the sinuses to decrease inflammation and aid training. Some emerging evidence suggests supplements of omega-3 fatty acids could be helpful for patients with smell dysfunction. So this is what DJ Elmo was talking about in the comment section. The omega-3. Patel and others are exploiting other treatments, including nasal injections of platelet-rich plasma and electrical stimulation. Patel said she hopes research funding and public interest in smell and taste dysfunction continue to grow so researchers can dive deeper and unlock new treatments. Before the pandemic, it was the orphan Cinderella sense, Patel said. It's only after so many millions of people have been affected or have had loved ones affected that people are coming to understand the huge impacts taste and smell have on your quality of life. So this is something that you're not really hearing about. These are the after effects of COVID-19. You know what I'm saying? There's many things that people need to consider after they've tested positive. And, the media is just not shedding light on it. TD says women definitely do have more accurate, acute sense of smell. My wife always talking about something smells funny. It's annoying as hell. That's funny as hell. I would say something, but I'm not gonna, as far as that situation goes with me. So, ladies and gentlemen, players and pimps, that's the end of the stream. I hope you guys enjoyed it. If you're not subscribed to the channel, you already know what to do. Make sure you smash that like button. Make sure that you guys hit the bell. Make sure that you guys follow me on my other social media and also follow all of the backup channels. And be sure to check out the clips on Just Talking with TD and Rob about this topic and other topics. All right? Peace.